Thank you. Thank you for giving me the chance to stand here. Okay, so I'm come from Chongqing, and my major is the HIFU treatment for different kinds of disease, especially in the maybe OBGY tumors or the breast cancer and breast fibroadenoma and any other malignant tumors. So today I will share some experience of our studies and also the clinical applications for the HIFU treatment of the breast fibroadenoma. So, as we know, HIFU treatment for the fibroadenoma is already inside the clinical, the Chinese guidelines. We know that for the benign and malignant tumor, we have this guideline, and also we have the Chinese expert consensus for the breast cancer and also for the breast fibroadenoma. So not only in China we have the consensus or have the guidelines, but also globally we also have the consensus about the HIFU treatment for the breast diseases. So this is foundation in America. So it will give a report every year. So in last year's report, it said that for the women's health, we have the breast cancer and the breast malignant tumor or the benign tumor that in most part of the world have already do in these countries and also in the insurance. And if we look back through the history of the HIFU technique for the fibroadenoma, we can see that at the beginning of this century, the first publications is the MRI-guided HIFU treatment for the fibroadenoma. And in 2003, there is a Chinese paper by our Chinese doctors. We have some case study report in the Chinese journals. And but if we look through the PubMed or any other database in English language, we can see that only in 2015 we have the first publication for the ultrasound guided HIFU, which I think this is Michael's group did that studies. So this is the history. And I will ask the question is that what is the clinical application and research advances of the ultrasound guided HIFU for the breast fibroadenoma ablation? So that means what we have been done yet and where we want to go. So before we ask where we want to go, we need to know where we have done it. So before we do the studies, the first step is that we need to do the systematic review and all the meta-analysis to do the literature study. So this is what we have done. So we have some searching terms, and we look through all the English languages databases, and until the last year August. So we just do the literature searching and for the reviewing. And this is our inclusion criteria and exclusion criteria. I do not do the detailed explanation. And we use this minor scale for the quality control. So that means if the score is less than 12, the total score is 24. If it's less than half of the 24, we just delete it. We do not include these papers inside our systematic review. And so this is what information we got from the papers we're looking through. So we have the basic information and also the treatment information and also the follow-up information. And we also use the software, which is starter version 17 for the meta-analysis. And we also analyzed the relative risk, and also we draw the forest and a funeral plot, and also we have do the heterogeneity tested to see whether there are any bias or not. And this is our flow chart for the literature section. So first of all, we find 110 papers, and after the inclusion criteria and exclusion criteria, we totally at last include 10 papers inside our the systematic review. And this is the baseline features of each studies. I think maybe half of the studies which was done by micro and micro student. And we can see that the papers, the patient's number is not so large, and also here is the age of the patients and also the volume of the tumors they treated. Okay, this is the baseline information. And we have the treatment information of each HIFU study, which is focused on the ultrasound-guided HIFU. We can see that for the first 8 studies, use the machine which is the Selection. So that is a different machine, not as we used today. But we can see that when we look through the treatment time, I think that the last 2 is our studies. We can see that for the Chongqing HIFU machine, we just have the effective treatment because we use the shorter time to ablate the tumors. And if we analyze the follow-up outcomes and also the adverse events, we can see that most of the patients are follow-up for 1 year, only 2 studies follow-up for 2 years, and the shrinkage rate has differences, and we will do the meta-analysis for these differences. And we can see the side effect is normally the minor or the small adverse events. That means only some skin, the skin changes, but not the skin burn. So this is from this systematic review, we found that it's a safe technique for the breast fibroadenoma. And also the patients are very satisfied with the cosmetic outcomes, and also the symptoms disappearance is very satisfied. And when we do the meta-analysis, especially for the shrinkage rate, 缩小率，这个病灶是怎么缩小的 ？So when we analyze this, we can see that overall, see this line. So 6 months after the treatment, we can see the shrinkage rate is around 50%. If we look through all the papers, and for 1 year's follow-up, we can see that it's around 70% shrinkage. And also here is the forest flow to show this data in 2 time points. And we also do the funnel plot to see there is any bias or not. And from this funnel plot, there's no bias. And this data is, this paper is already submitted and is under review now. And the next question we want to ask is that, is there any pathological proof and or is there any improvement of the effectiveness or the safety of the ultrasound-guided HIFU ablation for the breast fibroadenoma? And so we decided maybe to do some optimization. So first is the optimization for the equipment, the machine. And maybe we need some more pathological proofs for the to let the surgeons confirm that we have the totally ablation for even the benign tumor. And first of all, this is my PhD study, part of my PhD study. And I think we do the machine optimization the first because we know that HIFU use one small dot to ablate the tissue. So first of all, we need to sharpen the knife because we call it the HIFU knife. So that means from the standard transducer, we do a new, we invent or maybe with the engineers and to make a new transducer. That means the shape of the focus is much smaller and much intensive. So that means for the breast, because it's superficial and it should be much safer for the skin and also much more targeted to the tumor. And we do this is the ox liver experiment results, and also we have done some animal experiments. So we use the goat, and the breast of a goat is the size is similar like the humans. So we choose this for the animal model. So we can see that after the treatment, there is a change. Like you see this morning, there is a grayscale change if we ablated the breast tissue of the goat. And when we cut this tissue out, and we do the HE staining, we can see that there is a very sharp margin between the necrosed tissue and also the normal tissue. And if we just analyze the organs or the tissues in the acoustic pathway, that means the skin of the breast is very safe, and also the muscle or the membrane behind the breast is also very safe. There's no change. So we got the conclusion is that the upgrade of the transducers maybe improve the effectiveness and safety of the breast tumor ablation. So this is the first optimization for the life. So this also have already been published last year. And then the second optimization is that we try to brighten the eyes, because we know that it's ultrasound guided. So ultrasound is our eyes for this treatment. So we change the real-time ultrasound monitoring. Previously, we used the convex array, which is much better for the deeper tissue, like the fibroid or the liver cancer. But we know that for the breast, we need the linear probe, which can get the better image for especially the small lesions. Okay, and we also, as you have seen this morning, we use the underwater camera to help us to localize the tumor and also for the skin safety evaluation. So, and we also have that software to help us to shortening the positioning and the location time. So this is all in our new machine now. And then after we do this update of the machine, and then we start our clinical trials or clinical researches. So from 3 years ago, we have two centers. So one is our hospital, which is Jiangsu Province Hospital, and the other part is the Suining Central Hospital in Sichuan Province. So we have these two hospitals, and we have the same machines. And then we first to do the pathological evaluation. So this is our inclusion criteria for the patients and also the exclusion criteria for the patients. This is our study process. So first we just have our patients in the outpatient the clinics. So if we find the patient could be treated by HIFU, we just evaluate it by the breast surgeon, and also compared with together with the HIFU doctors, and then we do the core needle biopsy. After that, we just do an appointment for the patient, and then we do HIFU treatment for them. And if the patient's fibroadenoma is larger than 2 centimeters, we will do the resection around 3 days after the treatment, and we do the pathological evaluation. So this is in that period, we enrolled. So this is a phase 1 study. So we only include 20 patients with multiple fibroadenoma, so with more than 100 lesions. And there are 21 lesions who are resected after HIFU treatment. And here is the baseline information for the patients and also for the tumors. We can see the median size of the tumor is around 15 millimeter. And this is the treatment information. We can see that the sonication time is around 60 seconds, which is we do the dot, dot, dot. And the treatment time is around no more than 15 minutes. And we got the scale changes in a very quick, in a very short period. And this is how we look like during the treatment. First of all, we can see this fibroadenoma is like a hypoechoic. That is 低回声. Okay, so during the treatment, the focus, we have the gray scale change. So that means the dark one becomes the bright one. And after that, we just spread the whole bright one to all over the tumor. And then if we got this change, we stop the treatment. And we also have this, the sonoview before the treatment and after the treatment to help us evaluate the microbubble come inside or not come inside. Usually after treatment, we should go to this black hole. We call it black hole. There's no blood supply come inside the ablated tissue. And for some patients, we also, because for the research purpose, we communicate with the patients, and the fundings cover the fee to let them to do the contrast MRI before and after the treatment. And we can see that before the HIFU treatment, the blood supply is very abundant, but after the treatment, the blood supply is gone. Just around it, we have it, but the inside, there's no blood supply. And when we cut the tissue out, we can see that here is no ablated, so it can, the tissue is alive. But after the ablated, there's low TTC staining can be stained on the tissue. And this is HE staining. This is from the same patient. This is from the same patient. We can see that before treatment, this is a biopsy. And this is after treatment. This after treatment shows that the tissue is ablated and there's low alive cells inside. And we also do the NADH staining for the enzyme activity. And we also do the electronical checking for the subcell organs. We can see that here is the membrane of the cell cord. Before the treatment, it's very smooth, but after treatment, it's broken, totally broken. So from the tissues, we cut it out, and from the staining and also from the electronical checking, we can see that before the treatment and after treatment, the image is totally different. And we found that we got the necrosis. And also we want to know the safety. We can see that because all the patients are the multiple fibroid. Like this one, she has 6 lesions in one side. And we can see after treatment, if we just let clean the skin, we can see there's no change of the skin. Even for the patients with the previous scar, and it's a very severe scar. But we can see that the layer is very close to the scar, but the scar, there's no change and no skin burn. So we also published this last year. And the other question is that because HIFU is a new technology, when the new technology come out, we need to compare with the traditional treatment. And the traditional treatment for the fibroadenoma is the open surgery, and maybe which is most popular in China is the mammotome. We can see that these are 3 different kinds of treatment. So we want to know after these 3 kinds of treatment, what's the difference of the patients? So we just designed a phase 2 study. It's non-randomized, but it's prospective study. And this is our selection flow chart. So we divide the patient in 3 groups, and we compare. So our main outcome is that the quality of life, cosmesis, and the cost utility. Because we know that cost in China is a very important issue to should be considered by the doctors and also the patients. And this is our inclusion and exclusion criteria. And we just, for the enrollment, we've just enrolled the patient for about no more than 1 year. And after the enrollment, we have around 162 cases included inside our study, divided in 3 groups. Each group may have around 50 patients. And here is the information, baseline information for the patients. We can see that if a patient is older, maybe she will prefer to have the mammotome, because mammotome can give the pathological results to have the identify whether it's benign or the malignant. And for the multiple fibroid, the patients usually prefer to choose HIFU. And here is the treatment information. We can see that the number of treated lesions, so the HIFU group is much more than the other two groups because we know that it's non-invasive, so the multiple fibroid patients want to do it without malignant scar. And also the treatment time, we can see that the open surgery is the longest and the other two is comparable. And we can see that the pain is almost the same, there's no difference. And for the safety evaluation, we can see that there's no adverse events in HIFU group, and in the open surgery group, we have one infection, but it will recover within 1 week. And also in the hematoma group, we have one hematoma, and it will self-recovered within 2 weeks. And I think this is a very interesting result, is that the post-operative recovery in each group. We know that because the HIFU is non-invasive, so the pain relief is the shortest for the HIFU group. The other two groups have more days for the pain relief. And also for the patients come back to the normal work or to the normal life, the HIFU has the shortest time to come back to the normal life. This is to show the typical post-operative images. We know that because the open surgery and also the hematoma, after treatment, we need the bandage compress the lesion. So this is why they will have the pain or they can't do the normal work after the treatment. But after the HIFU treatment, there's no scar, and as you see this morning, the patient after treatment just go back home. There's no need to stay in the ward or overnight. And here is the typical cases in HIFU group in the follow-up. We can see that for these two patients, this is two patients. And this patient, the up line, we can see that after 6 months, the lesion is gone. And for the other patients, after 1 year, the lesion is gone. And we also compare the quality of life, use the SF-12 scale. This is usually used in the clinical trial. And we just divided the results in two parts, which is the physical health and which is the other one is the psychological health. So for the physical health, we can see that there's no difference in 3 groups. But when we compare the psychological health, HIFU group has the most improvement of the psychological health in the 3 months and 6 months follow-up. That means the patients maybe no worry about this anymore after the HIFU treatment, maybe. And here is the cosmesis outcome. We can see that we evaluate this 1 year after the surgery, and we just have 2 evaluations. The first, we just ask the patient whether they are satisfied with the treatment. And so from the patient self-evaluation, we can see that in HIFU group, we have the most population, or most percentage of the patients are very satisfied with the outlook of the skin. And for the surgeons, we also investigate this for the surgeons. So that means the doctors who did the treatment just evaluate what they think the patient's recovery. And we can see that for the surgeons, in HIFU group, the 100% they think is excellent cosmesis. And here is the comparison of the skin. We can see HIFU group. After treatment, you can even see a little scar. There's no scar. And the hematoma, we have the small scar. And for the open surgery, we have a very large scar. And it's interesting for the HIFU group, this patient. We can see in this area, there is a very previous surgery scar for the open surgery. And the last main outcome we compared is the cost utility, which is very concerned about the patients, because we know that in China the insurance not cover all the patients. So we use this Markov and DC analytical model. This is how we do. We use the software to help us to do this analysis. And here is the outcome. So this outcome is very direct because we just got this fee from each patient and we do the calculation. And we can see the direct cost of in HIFU group and in mammotome group is maybe higher than the open surgery. But in the indirect cost in HIFU group, because HIFU group has less disposable things than the other two groups, so the indirect cost maybe is less than the other two groups. And also because HIFU treatment, after treatment, the patient just come back to the normal work. So there's no loss of the income. So maybe this is why the indirect cost is lower in this group. And in the total cost, the HIFU and mammotome is higher than the open surgery, and mammotome has the highest. But this is only from one hospital, so it may not represent all over China. So maybe I think in our center we can do this again. Maybe in some other part of China we can do this again to see in your province what's the results. And here is the software analyzed results. We can see that. So when we compare in between each group in between, we can see that when compare HIFU with open surgery, so the ether value, which is normal, even the cost is higher than the open surgery, but we got the patient the quality of life improvement maybe is better. So that means HIFU has some advantages compared to the open surgery. And when we compare the open surgery with the mammotome do not have that cosmetic, the economic advantages. But I think this table is a little bit complicated. So if you are interested in, we will discuss this later after this presentation. And this paper is just published last month. So for the summary, from our studies, we think that the HIFU is a promising non-invasive treatment for fibroadenoma with the patient tolerance and also the faster recovery. But what we will go and what's our next purpose? So the perspectives. We think that maybe next we should do some dosage differences in different cans or different cans of the patients for the subtype of the pathological subtypes. And also we need to have some long-term outcomes for the treatment. And what's the influence factors for the shrinkage rate? We should answer this question. And also, because the patients, almost all the patients are very young ladies, they do not have their babies. Maybe they will have the babies after treatment and will have the lactation. So breastfeeding. So whether this treatment will have some interference with the breastfeeding, we do not know. So we need to answer this question maybe in the near future. So that's my presentation. Thank you.